What's on Your Minda contains honest, intimate, and uncensored depictions of mental health issues and experiences. Content and trigger warnings can be found in the description for each episode.
Welcome back to another episode of
What's on Your
Minda? I'm Amanda,
And I'm Diana.
and today we are going to talk about a thing that we literally do every day, which is therapy.
Yay! Therapy!
Yeah, we got questions from the audience. Thank you so much.
Yes.
Questions about therapy, questions about therapy modalities, training, approaches, how we do the work as therapists. So I'm pretty excited to dive
right
deep
into
into this one.
Maybe we'll get right in because the first question is actually quite a great way to start,
Yeah.
which is what are the different types of methods used by therapists and examples of how it would play out?
Wow, very concise
And specific.
question, very
right?
descriptive there.
No.
That's a good question. I feel like there's so many. I will not be able to remember and name everything. But from the top of my head right now, we've got stuff like CBT, which is cognitive behavioral therapy.
Yep.
That's very, very popular.
Yeah.
And then along the same line of this type of therapies, we've got ACT or ACT, which is acceptance and commitment based therapy. That's my favorite. We've also got DBT, dialectic
Cool.
behavioral therapy.
Yes.
We've also got psychodynamic therapy, person-centered approaches, humanistic therapy, existential therapy.
Yeah.
We've got, what's that thing called? EMDR. That's also another type of therapy. Eye movement
Desensitization.
and reprocessing.
Yes. Thank you for that.
Thank you. We work together on that one.
Yes.
Yeah, anything else that comes across for you?
Emotion focused therapy.
Yeah.
Yeah. So
It's not your favorite.
that's my favorite. I love anything emotion related. So and these are all based on not EMDR so much, but the other therapies that you've mentioned are actually different variations of talk therapy.
Yes.
Right? So talk therapy meaning you come to the session with your therapist and you talk
Talk it out.
Talk
Talk about your problems.
So an example of how it would look out, how it would play out. So if you're going for a CBT type of session, right, or a CBT approach, the conversation will be a lot about identifying some of your dysfunctional thoughts or negative thoughts that are really unhelpful or irrational, and you would work with your therapist on like how to reframe them into healthier thoughts. That's a
Yeah.
bit more balanced, a bit more neutral. And maybe one of the goals is to be a bit more positive in that sense, but it's not necessarily an aim in that sense. So it's more about debunking some irrational beliefs and thoughts that you might have. So that's how a CBT type of CBT type of approach would look like. An ACT approach, maybe you can share.
Yeah. I mean, ACT approach is a little bit different. While it has similar stuff regarding your thinking styles and your behaviors, it goes about in a different way where we talk about the values you hold and what
Yes.
are you doing to be committed to those values.
Yeah.
At the same time, the acceptance part of it is to increase your ability to accept your experiences, your emotions, because overall, the more you accept and the more you're tolerating about yourself as a person, as an individual in this world, that usually leads you down the path of contentment and happiness.
Nice.
So you do have some stuff where you're kind of thinking differently, but it's not so much about challenging, but sort of this is why I like it, because I use it for stuff where you can't change. For example, ADHD.
Yes.
You can't change that. So I love using ACT approach on with my clients who have ADHD, because there's a lot of things to accept about yourself
Yeah.
and then commit to the values you have.
Exactly. I think that's beautiful. Look, that also kind of goes into which one, it's not a question, but I think it's important to address, which is like what type of modalities or like if you're a client, right? Like, and you have so many types of therapies out there, what would be like suitable for you depending on, so it kind of like, depends on your goals, depends on what you want, and depends on the issue, depends also on what you've tried before as well. When we tried out CBT and it didn't resonate with you, so trying a different style would actually be quite helpful instead of completely writing therapy off
Yeah.
from one of your.
For example, like let's say you've gone and tried CBT and you're like, I've done all the work, I've reframed my thoughts, I'm so good at that. I'm up here, I'm so cognitive about it, but you still don't feel good, right? Maybe it's because a lot of your emotions are locked away, and then you want to go for something like emotion focused therapy instead, because you need the ability to like process that. But I
Yeah.
also want to hear a little bit about, because you said it's your favorite approach.
Yes.
Tell us a little bit about it and why.
So EFT or EFT is essentially a type of modality which uses a lot of emotion. So the focus is on sitting with the emotion, really in an experiential. So experiential means like in the moment of the session. So as we're talking about this event or this thing that has happened to you, what do you notice in your body right now as we're talking about it? So that's kind of bringing in cues to bring the emotion alive in the session, and from there you progress on like understanding, or it's actually just most of the time just giving the space for the emotion to be there, to kind of give it clarity and kind of let it breathe, almost, because we are a lot quick in suppressing or kind of pushing that away.
So easy to do that.
And because of our, which also then teaches us on kind of having little to no tolerance of tolerating uncomfortable, negative, or uncomfortable or painful type of emotions or big feelings, right? So, and from there, you get to use like a safe person and a safe attachment figure, either your therapist, a temporary one, or anyone in your life. How would you navigate to instill compassion and empathy to someone who's been through that? Instead, again, not rationalizing it, not intellectualizing it. It's more like giving yourself kind of a moment to just extend the compassion and hope and give the comfort for healing to happen, right?
Yeah.
Again, it's not to change the past, but it's
Providing that space.
yes, for emotions to be heard and for it to speak its story.
Yeah. So that would make sense if like you've gone for CBT and you're like, I still feel a lot of the emotions like trapped somewhere and I don't know what to do about it because I've gotten really good at reframing my thoughts. I think differently, but I still feel the same way.
Yeah.
This would probably be a pretty good approach to try out.
Yeah. Another approach that comes into mind, let's say if you are, you've tried it all out, and this is common for those who struggle with trauma, is more body-based type of therapy, like EMDR, for example, or
something somatic, right?
Yes, somatic therapy, where sometimes people or clients, they really struggle to narrate their trauma, and it's disrupting their life, and they want, or they have narrated it on a cognitive level, right? But you can sense that it's stored in the body. So going for like EMDR or somatic type of therapy actually helps to kind of release and process that trauma as well. Which is super cool, right?
I think
it's
so.
something that I'm interested in to explore and understand more.
Same here. But I
right.
think that these are the kind of therapies that, because we were trained in talk therapies,
Yes.
like we don't have the expertise or experience in conducting these type of therapies. So, but it's a really cool thing because it would really complement the approaches that we use, especially because a lot of the approaches are talking. It is, it has to still go through that filter. It's still coming out through your mouth, and we're talking and listening and talking and listening, but we're not really feeling as much as we could be. We're not really doing or being physical with it, which is such a big part of our lives anyway.
I would also want to add to that, like, depending on, like, because different people have different needs and they're at different phases in their lives, which they require different types of support. Even skill-based type of therapy, like dialectical behavior therapy, DBT, can actually be really, really helpful for those who are struggling with like really intense emotions, and they're just looking for skills, right, on how do I manage this kind of intensity, that I don't get swept by it, and that I don't result in like impulsive behaviors or like really unhelpful or unhealthy behaviors that can be quite dangerous, right? So it really depends on which stage that you're at and how and what you're looking for
Yeah.
and what resonates with you. I have
Yeah.
had clients who really loved CBT, even though I felt that it was not my preferred way, and yeah, I found it like, oh, this is really helpful, that it just made my overthinking absolve, which is awesome. Great job.
Great job. Yeah.
Yeah.
But when you said that, like, some people just want skills for the moment.
Yep.
I think another type of sort of modality to consider is short-term versus long-term therapy.
Yes.
So I feel like
Thank
a lot
you.
of us are more used to going to therapy because it's short-term, because we have certain goals. We want to achieve these goals, so we're going to go for therapy, talk about it, get some interventions, carry it out, and achieve these goals. But a lot of people are also in need of long-term therapy.
Yes.
So when you're also like looking for a therapist, keep in mind that, is this something you just want to do for a short while? Then the modalities that you're looking for may be a bit different. If this is something you want to do long-term, then the kind of therapist, the modalities you're looking for could be on the other end of the spectrum.
Yeah.
Because, for example, maybe a long-term therapy approach that I would recommend is something that's more humanistic or person-centered, right?
Yes.
Because the rest of it are quite short-term.
Yeah.
But you can definitely go to someone who does person-centered as well as these other approaches, like
Yeah.
us.
Yeah.
So
Like us.
plug in a little bit, since you're listening to our podcast. You can come to us.
Yeah.
We do short-term and long-term.
Yes. So, with that being said, thank you
Just
for
a
the
bit
plug.
of marketing.
Yeah. Yeah. I mean, I think it's important to use this opportunity to market ourselves. So, clients out there or people out there who are interested, for example, in ACT, or again, you don't just have to be struggling with ADHD. You can just be about like, I want to learn about myself, or
Yeah.
accepting myself more, or discovering what my values
Yes.
are. Amanda would be really, really great at that, and would
I love doing identity work as well.
Yes.
So anytime you feel lost in your life, this is ACT is probably a pretty good place to start.
Yes. And if you're interested in discovering more, understanding your emotions, if you're someone who feels, like I said, really deeply, and you don't really know or understand or what's happening, and have been constantly ridiculed for feeling so deeply, and it's affecting your work or yourself, or even with your identity and your relationships, you can come to me, so 'cause I
Yeah.
love working with emotions. Again, CBT as well, thoughts, but also so it's like eclectic. Eclectic means it's a combination, right? We
Yes.
can, it's not just purely one, it's also navigating or trying our best to accommodate also to what the client needs.
Yes, that's a very important thing as well, because we might be talking about our preferred approaches, but we do try to make sure that whoever is our client gets something that works for them,
Yes.
right? So if that means it's CBT, even though it's not my preferred approach, we can do it because we've been trained in it, right?
Yes.
The only time that it wouldn't be a good match is if you want us to perform an approach that we do not have. We don't have training in.
Yeah.
And then we would need to refer you out, right?
Yeah.
But other than that, we will try our best because we do have an eclectic approach.
Yeah. Thanks. With that being said,
Yes.
I think a very relevant question is about training and about therapy is, someone asked, how does your training as a clinical psychologist shape what you're thinking and noticing in clients in session?
Ooh, I thought that would go differently. I thought it would be noticing about people in general.
Can also, we can do your one as a second part.
Yeah. So, well, regarding clients, what do you think, Diana, as I think about it? Do you have thoughts about that already?
I do, because for me, I started out very CBT, very behavioral. So, in sessions, I was very quick to notice a lot of negative thoughts. And I was quick to also identify the unhelpful thinking patterns. So the ants, or the styles, the common ants and whatever you call it. So the way the client narrates about themselves, I'm like, oh, this is an ant, this is a belief.
Wait, hold on. What's an ant?
Okay, sorry. ANT stands for Automatic Negative Thinking Styles. ANTS. It's the acronym. So, according to Dr. Aaron Beck, he created CBT. So from his book, I forgot what it's called, but from his experience, he consolidated. From his experience of seeing depressive clients and anxious clients, or people who are diagnosed with anxiety and depression, he found there were 10 common thinking patterns. So that's what ants are called. The common 10 thinking patterns are overgeneralizing, black and white, catastrophizing, mind reading,
Mental filter.
Magnification, minimization.
All or nothing.
Yes, all or nothing, the black and white, 0-100. Emotional reasoning, that's a common one as well. So yes, from this, when I was back then, I was very quick to notice, to catch that. Oh, that's an ant. So that also then kind of contributes to the way I approach the session, which is like, okay, I notice as you're talking about this, immediately I can hear this sentence is a very clear overgeneralization. There's a very clear mental filter here, for example. So then we would work on like, okay, let's use that as an example on how would we like reframe this to become a bit more balanced. So that was my CBT days.
Amazing.
But now as I'm kind of venturing more into EFT or EFIT, more on the emotion focus, my kind of lens is I still notice the narratives, that's the ants that I'm talking about, but also my EFIT lens taught me of a whole different level to the session, which is being able to see rather than just the content that they're saying. So in CBT, it's a lot of like, I'm focusing a lot on the content of what the story is, what the words have been used, right? Whereas with my emotion focused approach, it's more on the process of more of like how the story is being told, right? What the body language comes, how is the facial expression, how is the tone,
right? Like what's being said, but what's the context of it,
right? Like, as I'm talking, suddenly I'm talking, and suddenly my voice drops, or my tone reduces, or I stop talking, right? So that is part of the process. Focusing, noticing that more in my approach in the behavioral observation. So a lot of the work would be, hey, I noticed, like gently trying to bring awareness to that. I noticed as you're saying that, like your voice or your tone just dropped. Is there something that's happening right now as you're talking about it? And you're like, oh yeah, actually, I'm feeling a little bit sad, for example. Trying my best not to cry as I'm talking about this, and it goes into that. So it's really cool, I would say, the kind of lens in the type of training you receive, or the kind of therapeutic approach you use. Like you can see back then when I was focusing a lot on CBT, I wouldn't have noticed that. I would be like, oh yeah, I'm talking about this, I'm trying you can hear the voice cracks sometimes, but because the approach or the focus is a lot on the thoughts rather than the process or the nuances of the behavioral observation in the session, right? So
that's so cool.
Yeah, that's for me. What about for you?
I think it's like similar to that at first, because I was also trained in CBT mostly. It was very the obvious things that you catch are the thought patterns, right? I wouldn't say I was as good as Diana at memorizing what those were. I can be like, that's a negative thinking style. Let me look up what it is. That's just me. Realistically, okay? My brain is not. I need external hard drive. Okay. But like similar to that, right? So we'll be able to clock certain, like, okay, what you just said was this. It was like very critical of yourself. It was this kind of pattern. It was an all or nothing thinking. The little nuances of the behaviors. I think for me personally, because I use the ACT approach so much, the main thing that I can like sense now is if they're stuck at something. There's something there that's like not working for them, and they keep getting stuck. They keep trying the same thing, it doesn't work. and they get stuck there, and that's what leads to a lot of like the helplessness, other emotions, depression, anxiety, whatever. But I can like quite quickly notice that nowadays, especially if it's something regarding identity or like self-worth, self-esteem. Like if they say something, I'm like, this, I know this person doesn't think highly of themselves. That's something that I can already see. Or the way they talk about themselves is like, it's obvious to me, so then I'd go into like, tell me more about how you view yourself. When this happens, when this mistake happens, what happens? What do you feel? What do you think? And most of the time they're like, oh, like, I feel like I made such a big mistake. I'm so stupid for doing that. I should have done better and stuff like that. And then I'm like, okay, I got you. Got you. And I'm like, sounds like you have pretty low self-worth. And I don't say it like that. I say it gently, guys. Don't be scared. I say it gently. But yeah, so that for me, it's more about that. And especially if, let's say, we've already gone through their values, then if they're saying like, let's say one of their values that they've talked about was independence, right? But then they keep talking about how they have to get approval from their partner, for example. Like, oh yeah, but my partner doesn't let me do this, my partner doesn't let me do that. I'm not sure if my partner will like that. Then I will bring it up like, remember we talked about your value about independence. How does this correlate with, what you're feeling? And so we're sort of really challenging, why aren't we committing to this value that's important to you?
Wow.
Yeah. So that's something that I'm like, I can like sort of sense because of what we've done.
Nice.
Yeah.
That's really cool.
Thank you.
Awesome. I love to see the differences.
Yeah, because we actually have pretty different approaches.
Yes. Yeah. But it's interesting because even from those two different approaches, I think we still reach the same end goal, the same result, which is ideally like relief, right? And a sense of self-betterment, increased self-acceptance, self-worth, and this goes beyond than just the self. Also, it shows in also your social relationships, your satisfaction within your life, increased quality of life.
Yes, that's the one. The end goal, no matter what, is usually related to a better quality of life.
Yes. So it depends on however resonates with you in the way you want to get there, right? Therapy is one of it, and even in therapy, the different styles of therapy. Is it through cognitive? Is it through behavior actions? Is it through committing and identifying your values, right? Is it through processing your emotions? Is it through learning skills through DBT, for example? Or even for psychodynamic, is it through understanding your experiences or your dynamics in the past as a child, inner child work, and things like that. Which
is pretty cool.
Yeah.
It's also interesting because like with these differences in approaches, we would obviously be picking out different things in our clients.
Yes.
But I also feel like the kind of clients that come to us are different anyway.
Yep.
Like the kind of clients that gravitate with us and like who feel like they like our approach can be pretty different,
Yeah.
So I'm just wondering, Diana, like, do you have any particular clients or like your viewpoint on clients itself, right? Like, do you notice any similarities with the kind of clients that come to you?
Oh my god, I do.
Yeah.
I really do. And sometimes I feel like, oh man, it would be awesome if we could have a support group for all of them.
Right. I wish I could link them up,
I
but
know.
that is breaking confidentiality.
That's why it's not ethical. But yeah, that's, I guess, the silent woes of this job. It's like, oh man, if only I just know the right person. I'm not saying the right person, but having a group or a community, right? And you're right. I do see similarities. I see commonly those, for at least for my type of work or kind of focusing on emotions, is a lot on emotions. So either people who are not as emotionally attuned, or what I mean by not emotionally tuned is it's not so much about attunement, but it's more expression, right? So it's a lot of like avoiding emotions, a lot of suppressing it. Clients who are struggling to express that, and it shows in like their relationships, for example. Like one of their intentions for them to come to therapy is actually very much initiated by their partner. Yeah, it's like, oh, you need to go to therapy because I'm not feeling emotionally fulfilled. Right? It's like you're emotionally stunted, right? And then they come, and it's a lot of the times there's a lot of fear underneath with emotional expression due to negative experiences with vulnerability, right? And then also get on the other side, which is clients who deal with a lot of emotions, like really intense type of emotions that they feel like, oh, why am I like, why is it like, for example, my partner not as bothered by this as except for me, like I'm so bothered by this, it's terrible, I don't like it, which actually, again, it's a lot about self-acceptance in like your emotional capacity in a self-compassionate way. So it's really interesting. I do see commonly with avoidance, especially with I think avoidance can be viewed in many ways, not just like avoiding emotions. It could also just be feeling things and then avoiding confronting it, or avoiding addressing it, for example. So that's the common ones I see. What about you?
It also sounds like a lot of the people who come to you have relationship issues.
Oh yeah.
Right?
Yeah,
it's very
actually.
interpersonal relationship as well, really. Like their goals are related to that.
Yes, and also related to, which is really interesting because yes, it's about relationship issues, but it can also be tied back to their childhood experiences. So their attachment with family. So also not just with they're relational, not just romantic, but can also be with family. With most of the time it's like their relationship with their parents, or with their siblings, or with their whatever it is that a lot in the past as well. So it's a common theme I see.
Okay, it's so different for me. I feel like most of my clients, they are in relationships, but their main goal is not relationship related. It's not interpersonal. Their main goal is very self and identity, which is again, like, because of the approach I do, right? It seems to make sense, that they would come for this. And of course, I think overwhelmingly most of my clients are neurodivergent and or identify as LGBTQ. And I feel like a lot of identity work in these two aspects are so important, especially when it comes to like self-acceptance, self-love, self-image, self-worth in the bigger society. So it seems like that's the kind of clients I would see who are more attuned to that, or their goals are like, I feel like I don't know who I am, and I want to figure that out. My goals are to like work on myself. A lot of my clients' goals is to work on myself, work on my emotions, my symptoms, my work, these kind of things, right? Which is so cool because like a lot of my clients are in relationships, but they're not really coming to me about relationships. They're coming to me about those things,
True.
Which is so cool.
But I also want to say, like, sometimes the way I do get a lot of clients who come because of their self, they want to work on themselves, which is interesting also because you can see that sometimes goals do evolve, right? And the issue, because once we talk about it and we understand it on a deeper sense, or like you lay it out and you have a third person to look at it, it might not be as what it seems, right?
Yeah.
So it's interesting that it's a lot of self for you, whereas for me it's like a lot of interpersonal, relational, which is also my huge interest. I really believe in relational work, in healing through relationships, especially healthy ones. So
attachment is such an interesting topic anyway. Check out our episode on attachment that we did before.
Or maybe we have an updated one soon.
Maybe.
If you have any questions about it,
let us know.
That would be awesome. By the way, we got a question related to us being therapists. It's a really spicy question.
Spicy?
Do you ever get annoyed with your clients?
Oh, interesting. Annoyed. I need to think about this.
What?
Like, what? No. I'm so chill and neutral all the time. No, I'm a human being. It's not so much about like being annoyed in the sense of like, ugh, I wish this client would stop talking. It's nothing about that. But I think the annoyance or frustration that happens in therapy sessions is more related to, for me at least, for me personally, is it's more related to my inability to help them in the way I wish I could.
Yes.
So a lot of the frustration is, it is directed at myself, but it's also directed at like, oh, if only, you see it this way, right? Which we're not there yet, because obviously therapy takes time. It's a process.
Yeah.
But that frustration can happen because we're, like I said, we're human beings, and it's so normal, right? Like if you were working on a project with a client, not a therapy client, but corporate work, I suppose, with a client, and that client doesn't seem to want to agree with you on this project that you're working on, you would also get annoyed and frustrated. So it's such a normal human emotion that, yes, it happens, but as to elaborate on that, it's not about the client all the time. It's not about their lack of something. It's not about that, but it's about the process of therapy.
The work itself.
The work itself.
Yeah.
Yeah. What about you?
I would say, to add to that it's also important. That's why these feelings are real, right? And these feelings are, sometimes we have to acknowledge that they're there, which is very, very human.
Yeah.
Right? And it's a thing that's also been identified scientifically, which is called countertransference.
Yes.
Right? That countertransference is the feelings you get as a therapist towards your clients, right? And in this case, annoyance towards your clients. And that's why part of our training and part of the work that we do is we practice, or we try to practice supervision.
Yeah.
Because we do get these blind spots, emotional blind spots, cognitive blind spots, to address these very real feelings, right? That,
Yes.
and to exactly like what Amanda said, to approach it in a way of curiosity, to understand actually what is this annoyance about. And most of the time, it's not really much about the client. It's a lot about the therapist's frustration, or whatever it is that they feel about the work that they're doing, or about how the session is panning out, or their expectation is not aligned, or whatever it is that the therapist is dealing with. So it's not a very straightforward answer to be like, do we ever get annoyed with clients? Well, technically,
yeah.
yes, but it's not as simple as, or not as straightforward as you think, is being like, oh my god, my therapist is annoyed with me because I'm annoying, because I talk too much. No, talk more.
Talk more. Actually, it's talk therapy, isn't
It's
it?
talk therapy, yeah.
It's actually for you to talk.
Yeah.
The more.
So the more you talk, it's awesome. And if you don't talk, that's okay too.
It's also okay.
Humans are not that
Not the
2D,
same.
two-dimensional.
Yeah,
We're not either this or that. It's okay.
Yeah.
And that's what I said. The styles are there for a reason. Your therapists have gone through training for a reason to handle different types of personalities.
Yeah.
And again, sometimes it just doesn't align, and that's okay. That's not anybody's fault. It's not the therapist's fault or the client's fault. It's just a misalignment, because we're human beings. We just don't get along with everyone.
Yeah.
And that's okay. You will find someone that you can get along with.
The chemistry is, you have to look for that chemistry. If you
Yeah.
feel comfortable with a therapist, great. If you start and you're like, I don't really vibe with this therapist, that's fine.
Yeah.
Find another one, because it's about your comfort. It's about your ability to trust and then be vulnerable in therapy. That's the goal of therapy,
Yeah.
So, yeah, and you can be annoyed at us too.
Yes.
As the client, you 100% can be annoyed at your therapist because you're like, I'm being pushed too much. I'm being pushed too fast.
And we encourage you
and
to
tell us.
Yes,
Yeah.
to tell us, to bring that in the session.
Yes.
Because again, it's really, really helpful.
Very helpful.
Honesty and transparency helps with the process.
Yeah. And that's called transference.
Yes.
So if the client has feelings towards the therapist, that's called transference. And if the therapist has feelings back to the clients, it's called countertransference. So any type of emotions, positive, neutral, negative, whatever.
Yeah.
That's what it is. It is an identifiable psychological effect that happens in therapy.
Yes. Because we're humans, and it's a human thing that we're doing. Being vulnerable
Yes.
especially if you're the client.
Yeah. I feel like talk therapy or like mental health care is one of the more vulnerable professions that you
Oh,
could
yeah.
have, but that also means that it's not just the client being vulnerable,
Yep.
it's us. We have to have been vulnerable to be better therapists.
Yeah.
Otherwise, we wouldn't be here. We would be stuck in our own ways. We wouldn't have made progress. We wouldn't have grown to become better therapists.
Because it takes vulnerability for you to realize your blind spots, for you to realize you can't see everything, right?
Yeah.
And
To realize
why-
your mistakes, to
Yep.
realize what you need to do to fix them.
yes,
Yeah.
hence the supervision, hence the peer support, hence the professional development,
Yes.
all in place, and having strong ethical code and professional standard way of practice is all important. So these are also ways that you can, if you are out there and trying to gauge how to find a therapist, these are some of the ways that you can see what are the therapist's values, what their approach is like, what is their experience dealing with a specific type of issue or a specific
Yes.
type of personality or client or characteristic, or whatever it is that you are curious about, right? Which helps to hopefully ease your process in finding support and therapeutic help. yeah
Yeah.
yeah
Yeah. I feel like that's actually a pretty nice way to wrap it up there.
yeah
As always, if you're looking for therapy, we've covered a bit about what we do today. So I just want to put in a little bit more marketing at the end that you can always come to us, right? Like this platform is for us to not just talk about these topics as clinical psychologists, but also that to make it more accessible to people. So the more people watch this, maybe you'd figure out like, hey, I want to have therapy, and like one of the people hosting this podcast, I resonate with that person, so I want to go to them. Like that's how it works. So trust yourself, trust your instincts, and maybe we'll see you in a therapy session. But anyway, if you have further questions about therapy, about the approaches, modalities, or anything regarding our experiences as therapists with clients, feel free to let us know. You can DM us on Instagram at Minda Psychology. If you're watching this on YouTube, comment below. If you're listening to this on Spotify, you can also comment. You can also email us at hello@mindapsychology.com, or just check out our website at mindapsychology.com. Thank you so much for watching. This has been another episode of What's on Your Minda. Thank you so much. Bye-bye.
Bye-bye.